removal for a long time has always been related to cosmesis, like a cosmetic procedure, because maybe somebody doesn't like their excess hair on their upper lip or their underarms. But there's a true value on doing laser hair removal for medical conditions, particularly medical conditions that affect the skin. One of the lasers that we use, that we have available at CU Dermatology Montview, is called NDJAC, and that laser focuses or targets the root of the hair follicle where our melanin is, to basically destroy that root of the hair follicle, and with that can decrease not only the density of the hair, but more importantly decrease inflammation and help with chronic conditions like hidradenitis suppurativa, pseudofolliculitis of the beard area, and also pilonidal cysts. Laser hair removal targets inflammatory conditions that happen frequently on hair-bearing areas like your underarms, inguinal folds, and also between your buttocks. It also obviously has the advantage of decreasing hair density, but the decreasing hair density is not permanent. I think one of the questions that we have a lot when patients come, say if they want to have laser hair removal for cosmetic purposes, is that laser hair removal is not permanent. We can achieve about a 90 to 95% decrease in the hair density with laser hair removal. However, the hair can still regrow at some point in time, as opposed to electrolysis, which is a different type of procedure where you actually are burning each hair follicle and destroying it completely. Doing medical laser hair removal does involve some paperwork between your provider and insurance companies. As mentioned before, diagnoses like hidradenitis suppurativa, pilonidal cyst, and pseudofolliculitis of the beard area are typically covered by insurance as long as your provider can provide pictures, obviously a history, mention what things you've tried and failed to treat these diagnoses, and sending that or submitting that to insurance. We typically accept all insurances at CU Dermatology Montview, including Medicaid. If you're getting tender bumps that come and go and are painful and draining on skin folds, that's one reason to consider having a visit with dermatology, because it's possible that you have hidradenitis suppurativa. If you get tender bumps that are painful or scarring around the beard area or the neck associated with shaving, that would be another reason, because that could be the presenting signs for pseudofolliculitis of the beard area. And if you're getting these tender bumps that come and go between the buttocks, that will be again another reason to visit dermatology, because it's possible that those are not just ingrown hairs or bumps from sweating. It could be something deeper like pilonidal cysts. If any of those happen, do visit a dermatologist to have an evaluation, and then visit us at CU Dermatology Montview to get laser hair removal.